Call the honourable member for Reid.
It is no accident that on the front page of today's Sydney Morning Herald is a photograph of one of my constituents, one of the people in the areas that might have once been described as Howard's battlers. People that are socially conservative but have doubts that they're getting anything out of the Australian system. She was visiting a medical centre and it was focusing on the question of this $7 impost. And it's not surprising because in Reid 96.2% of visits are covered by the current bulk build. As earlier speakers have indicated, this change is created through a confected propaganda campaign about a crisis. It's worth noting in the actual facts that the total health and expenditure in the United States, where they want to emulate, where they think there's something to learn, is 17.7% of GDP, and in Australia it's 9.5%. So while Clinton and Teddy Roosevelt and a whole lot of other people have been fighting for a system like Australia for virtually 100 years, they want to destroy ours, despite the fact that the GDP ratio cost is nearly 2 to 1 over there. And if we just look at the question of government expenditure on health, we notice that as a percentage of GDP, we are the 10th lowest of the 33 OECD countries, and we are lowest amongst the wealthy countries. I was here when Costello used to carry on about comparisons of Australia to Central African Republic and to Botswana. And I agree with him. The people we should be comparing ourselves to are the first world. And we see those kind of figures that in actual fact the GDP expenditure by this country on health is very low. And yet they're using this contrived crisis to try and destroy this system. And it's worth noting that even in general government expenditure, and I'm indebted to the member for Fairfax for photocopying off the question of general government net debt as a percentage of GDP, showing that in 2013 Australia's was 13.5% and the advanced economy 73.5%. So they're manufacturing this so-called crisis to justify a system which is about destroying Medicare. We've heard earlier there's not just the question of the $7, it's the fact that there are now financial disincentives for doctors to bulk bill, and it's also, of course, accompanied by an $80 billion attack on health and education in general, abandoning agreements that were made with the states. And is it any wonder that state Liberal governments, state Conservative governments are now denouncing them for what's occurred? Because their systems are going to be under very real pressure. Another indication of the way in which they've manufactured statistics to justify this is our old friend in the Commission of Audit, Mr Shepherd, who alleged that there are 11 visits per Australian in regards to doctors. When that was actually looked at, a variety of statistics indicated otherwise. The figures from Medicare show that of 128 million visits of GDPs last year, giving an average of 5.6 visits. The National Health Performance Authority, an independent agency, put it at between 2.4 and 7.4. So in actual fact, the statistics are wrong in regards to the level of visits. The alleged abuse, the alleged people using doctors for social visits is actually not a reality. And I don't think we should necessarily restrict ourselves to the views of the opposition on these matters. I want to just quote a few perhaps more independent, respected authorities on the impact of this. The Royal Australian College of General Practice has said that the government has failed to meet its promised commitment to those in the community with the greatest health needs. They further commented, it's seriously compromising every point of access to the Australian healthcare system. Another eminent organisation, known to the member in the chair, the Rural Doctors Association of Australia, has alleged that the real danger is that many of the poorest rural patients will choose not to see a doctor for preventive health care. That will be the outcome, that people who have numbers of children with health problems are going to actually decide not to visit. People who have got conditions that are not at the moment chronic will have them go to chronic as they're untreated. And that's the intention of these people, to basically make sure that, that people don't use the system, to undermine it on all fronts. I want to finally comment about the attacks on young people. I note the two things that are going to affect in my electorate is the massive cut when they're trying to basically force them onto the dole, force them to live without payments. At the same time, they're attacking the rail system, which is so vital in my part of Sydney because people buy houses cheaply there and actually sacrifice travel time. They're going to basically strip back very massively rail expenditure in the country, and at the same time, for those that actually possess a car, make it harder for them to get to work and in regards to increased petrol charges. And as I say, at the same time, basically impoverish them as much as possible.